13 years old Sonu was brought by her mother to health center with complaints of pain associated with menstruation. Answer the following questions. These questions answer contain 10 marks. First one is define dysmenorrhea. In that the B1 is explain types of dysmenorrhea and C is discuss the management of primary and secondary dysmenorrhea. Definition of dysmenorrhea. The answer is definition. Dysmenorrhea is defined as painful menstruation. The term dysmenorrhea is derived from Greek word. This means difficult or painful or abnormal. Meno meaning month. Oria meaning flow. The second definition is dysmenorrhea, also known as dysmenorrhea, painful periods or menstrual cramps, is pain during menstruation. Dysmenorrhea is the term described painful menstruation that typically involves the cramps caused by uterine contractions. Then second question is explain types of dysmenorrhea. Coming to types, dysmenorrhea is divided into two categories. One is primary dysmenorrhea, the second one is secondary dysmenorrhea. Primary dysmenorrhea is painful menstruation with no identifiable pelvic pathology. In that, the highest level is in the first 2 days of menses. This is the definition of primary dysmenorrhea. Secondary dysmenorrhea is a painful menstruation due to pelvic or uterine pathology. Coming to primary dysmenorrhea, etiology of primary dysmenorrhea. During menstruation, prostaglandin F2 alpha is released from endometrial cells. Then uterine smooth muscles contractions formed and some degrees of uterine ischemia. This is associated with painful and sometimes debilitating cramps. Prostaglandin production during the first 48 to 72 hours of menses, and prostaglandins may also cause the hypersensitization of pain terminals to physical and chemical stimuli. Behavioral and cultural and psychological factors influencing the patient reaction to pain also. This is the action of the prostaglandin. Then coming to features of primary dysmenorrhea. Starts with ovulatory cycles 6 to 12 months after menarche, then begins few hours before or with the onset of menstruation and usually lasts 48 to 72 hours. The pain is crampy, colicky, usually strongest in the lower abdomen and may radiate to the back or inner thighs. Risk factors of primary dysmenorrhea in that early age at menarche, long menstrual periods and heavy menstrual flow, smoking and positive family history. Features of primary dysmenorrhea associated with symptoms: back pain and pain in the upper thighs 60%, nausea, vomiting, sir 89%, diarrhea 60%, fatigue or malaise is 85%, headache 45%, dizziness, nervousness, fatigue, fainting in severe cases. Symptoms in that wither shortly 6 months after menarche and fluctuating and spasmodic cramps, labor-like pains, begins few hours before or with menses, most intense first 24 to 36 hours, last 2 to 3 days. In that suprapubic and radiating to thighs and back, nausea, vomiting, dizziness, diarrhea and no pelvic pathology. Coming to secondary dysmenorrhea. Cases which may indicate secondary dysmenorrhea occurring during the first or second cycle after menarche, which may indicate the congenital outflow obstruction. Dysmenorrhea beginning after the age of 25 years, pelvic abnormality with physical examination. Secondary dysmenorrhea. Dysmenorrhea not limited to the menses, less related to the first day of flow, and little or no response to therapy with NSAIDs or oral contraceptives or both, usually associated with other symptoms such as dyspareunia, infertility, or abnormal vaginal bleeding. Causes of secondary dysmenorrhea: endometriosis, chronic pelvic inflammatory diseases, adhesions, and Mullerian duct anomalies, adenomyosis, endometrial polyp, fibroids, ovarian cyst, pelvic congestion, imperforated hymen, transverse vaginal spectrum, cervical stenosis, IUCDs, copper. The causes of endometriosis: pain extended to premenstrual or postmenstrual phase or may be continuous, may also have dyspareunia, premenstrual spotting, and tender pelvic nodules. Onset is usually in the 20s and 30s, and but may start in teenage. Then pelvic inflammation. Initially pain may be menstrual, but often with each cycle is extended into the premenstrual phase, may have intermenstrual bleeding, dyspareunia, and pelvic tenderness. Adenomyosis, fibroid tumors. Uterus is generally clinically and symmetrically enlarged and may be middle tender, and dysmenorrhea is associated with a dull pelvic dragging sensation. Pelvic congestion. A dull, ill-defined pelvic ache, usually worse premenstrually, aggravated by standing, relieved by menses, often a history of sexual problem. Management or preventive measures of primary and secondary dysmenorrhea. In that, primary prevention include health education and motivation of lifestyle changes. General measures: improvement of general health and simple psychotherapy, usually activities such as sports to be continued. Then lifestyle modification: low fat vegetarian diet, decreased consumption of food like caffeine, salts, and sugar, exercise, walking, swimming, running, and bicycling, aerobic, dance, smoking cessations, and hot fermentation. These are the lifestyle modifications. Diet: calcium, magnesium, vitamin B1, and the essentially fatty acids are helpful for treating acute menstrual pain. Increase the consumption of whole grains, green vegetables, legumes, and seaweeds. Cold or sour food should be avoided, especially on week prior to or during menstruation. Secondary prevention in the diagnosis and treatment. History collection from patient. Pain analysis, associated symptoms, menstrual history, gravity and parity status, infertility, previous pelvic infections, dyspareunia, pelvic surgeries, injuries, or any procedures. Sexual history also. Examination. A pelvic exam is indicated at initial evaluation, which should be performed to exclude uterine irregularity, cul-de-sac tenderness, or nodularity that may suggest the endometriosis, pelvic inflammatory diseases, pelvic mass, It should be completely normal in a patient with 1 year dysmenorrhea. However, if evaluated during the pain, uterus and cervix will be mildly tender. Investigations not required if history or physical examination are consistent with 1 year dysmenorrhea. The following can be performed to exclude organic causes of dysmenorrhea: cervical culture to exclude STDs, WBCs count to exclude infections, ESR, and HCG level to exclude ectopic pregnancy, abdominal or transvaginal ultrasound, hysterosalpingograms, other more invasive procedures such as laparoscopy, hysteroscopy, etc. And DNC also performed. Management. NSAIDs in that brufen, norfloxacin and mefenamic acid, and oral contraceptives that are 90% effective if NSAIDs are not effective or contraindicated. Some patients may require combining both drugs, considering 2 years dysmenorrhea if no improvement with therapy. Mechanism of action: NSAIDs are inhibit the prostaglandin production. Antagonists action at the receptor should be used with the start of pain regularly for 2 to 3 days. Oral contraceptives. These are decrease the endometrial thickness and decrease the prostaglandin through the inhibition of ovulation and change the hormonal status to that of the early proliferative phase. Third one is tocolytics. Resistant cases may respond to tocolytic agents, for example, salbutamol and nifedipines. And prostogens, especially medroxyprogesterone acetate or dydrogesterone in daily high doses may also be beneficial in resistant cases. And fifth one is non-pharmacological pain management is acupuncture and transcutaneous electrical stimuli and psychotherapy, hypnotherapy and heat patches. Surgical procedures are presacral neurectomy, uterosacral nerve ablations have been largely abandoned. Medical treatment: dysmenorrhea, primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea in that NSAIDs and oral contraceptives, vitamin B and vitamin E. Other one is the acupuncture, acupressure, and severe dysmenorrhea, treatment of underlying diseases, and tertiary prevention in that referral and follow-up. Considering the unchanging conditions of patient, she should be referred to the next higher medical facilities nearby, and follow-up is it is necessary to follow up of cases referred by you and inquire regarding the condition and relief of the symptoms. Thank you for watching this video. Please subscribe my channel and like. Thank you.